I'd like to introduce you to Brett. Brett's a young man who works away up in the mines. He came to see me because he was very embarrassed about his smile. With most people, they get their permanent teeth. Unfortunately, there are some people that actually don't get their permanent teeth, and they're left with some permanent teeth and some baby teeth. Most baby teeth are lost at about the age of 12, 13, and that's when all the permanent teeth actually come through. In Brett's case, those teeth didn't come through. So what we've ended up with is some teeth on the top, a mixture of baby teeth and a mixture of permanent teeth, and on the bottom, he's actually got no teeth. So we'll go through some of his slides and we'll look at how do we go from a very, I suppose, a very complex case to giving a young man a great smile. So this is basically a close-up of his face the day that he comes into the practice, saying that he wants a smile. It was very hard for him to smile for this photo. He's not someone that is comfortable smiling. So the question we have is really, how do we go from someone that's got very few teeth to a great smile? So we want to really go through the process of really ending up with a smile like this. Let's go through to the start and we'll actually look at how he presented when he came into the practice. So this is what the teeth actually look like. This bottom section here is actually a denture. It's a full denture that a man in his 20s is wearing. Very uncomfortable for someone of that age, or really uncomfortable for anyone to be wearing a denture. But you can see that there's a crack running through the denture. The denture is extremely worn. He has some permanent front teeth, so he's got a combination of some front permanent teeth, maybe a back. He's got a couple of back permanent teeth down here, but a lot of these teeth up here are actually baby teeth. They're baby teeth that have not had their permanent teeth behind them. So what's happened is they've remained in his mouth for this time. Going forward, we'll actually see what his denture actually looked like. We've got the denture here, it's in two parts. He has to juggle this plate all the time. So when he's eating, when he's talking, he's trying to hold this plate in with his tongue because it's in two sections. It's also not fitting well. You can see it's been there for a long, long time. And when plates are more than 5 years old, they start to move, they start to jiggle around in the mouth, and it becomes quite difficult to talk, eat, and smile with it in. Go forward now to his implant. So when you lift that plate off, what you see is you see a mismatch of implants. You see these different widths of implants, these different angulations of implants. In our implant cases, the most important thing to do is have parallel implants. So when the implants are placed, you really want the implants to be all in line with each other. He had these implants in when he was much younger, probably about 5-10 years ago. And when the implants was placed, there were many different implants. He had started to lose a lot of bone on some of the implants. He's got decay because the plate used to sit over the top, so he's got a lot of root decay here. And really what we need to do is we need to salvage the implants that we can, but we need to put some new implants in, and we've got to fix up his smile here at the top. So the way that we've done this is we've really looked at his x-ray here, and you can see that these implants are not parallel. You've got some that are very upright and straight. You've got others that are on a very sharp angle, and it's those implants that are very difficult to use. So in some of these cases, what you end up doing is removing some of these implants and using the good implants that are parallel to actually build up on. This is his final porcelain. What we've done here is we've had to remove certain teeth, but we've actually designed his smile. So here, going through again, communicating with the patient well, him choosing the color of the teeth, the shape of the teeth, the texture of the teeth. We've actually been able to create really a new smile for him. On the bottom, this is what we call a implant retained bridge. Implant retained bridge means that we're using the implants to support teeth, and we don't need one implant for each tooth. We're using the implants that he had and also placing new implants to screw in what we call a bridge. So here you can see the screw holes here. We're basically going to screw these into the implants, and then we're going to cover these holes, of course, with fillings. I'll show you what it looks like from the back. You can see the metal behind and the teeth in front. The metal is there so that it is strong. You need metal foundation so that the plate is always strong, but you need, of course, the white aesthetics so that they look beautiful. Once we've actually then put this case in, you can see the bridge is now in place. We've put the teeth on, we've taken out some of the baby teeth, we've replaced some of the baby teeth with implants or bridges. We've of course got the cosmetics and the aesthetics correct. So we'll go through and actually see this in close-up, how, I suppose, in detail, the type of artistry that the technicians go through, and also making sure that the patient's wishes, what he communicated with the shape and colour of his teeth, is actually correct. This is Brett on the day of putting it in. This is probably 5 minutes after we've just finished up his case. He's having a look at his teeth. Of course, being numb, it's a bit hard for him to smile. Pretty happy there, he is smiling just after we've placed the case in. These are some of the close-ups actually of him here smiling. Definitely a happy patient. And again, I suppose the biggest thing for some of these patients is, again, learning to smile. Brett's been someone that hasn't been smiling. Now he's got a new set of teeth and a smile, and it has really made such a difference to his life, because now he's been able to smile, he's been able to eat properly. A functional is also very important, being able to function very, very well, and he's a happy young man.